He has 20 research papers in his credit, which includes his research in different fields like pattern of snakebite in tertiary care center, then occupational hazards, mechanical injuries, and estimation of stature, etc. He has participated in workshops, which includes the MET workshop. He has also participated in the 4 seminars and 19 CMEs programs in different institutes in the state of Maharashtra, Karnataka, and Gujarat. He has presented a topic, medical certification of cause of death, procedure and precautions in CME on medical legal aspects of death in the clinical practice held at Krishna Institute of Medical Sciences, Karad. He has completed 2 research projects and 20 copyrights published. He is sports in charge in Krishna Institute of Medical Science, Karad since 2016 till date. So we have this multifaceted speaker. We are eager to know you from sir. So please proceed for your lecture.
First, greetings from Krishna Institute of Medical Science, Karad. First, I would like to thank the entire organizing committee of D.Y. Patil Medical College and Department of Forensic Medicine for giving me an opportunity to present on the topic errors in filling up of medical certification of cause of death. Myself, Dr. Chandrakanth. So in this session, I would like to highlight on the errors. So objectives of this session are: what are the common errors in filling up the MCCD and the type of errors in filling up the MCCD and how to avoid them. So all the previous resource persons, Dr. Mohan Pawar, Dr. Ashtosh, and the madam, they have highlighted on the MCCD. Now I will try to highlight on the errors. Death is a certain for every birth. So is the cause for every death. So this medical certificate of cause of death is the important source of population-based mortality statistics. There is no adequate training received by the physicians for filling up in the death certificates correctly, because during in our undergraduate curriculum we see that during second year there is a MCCD, and during internship also there is a casualty postings, but we are not really trained in how to fill up these MCCD, because we are not performing independently. In the CBME there is how to write that MCCD is there, but as a MBBS student we are not independently writing, but we are just seeing the MCCD formats or the case sheets. So if there are any inaccuracies in the completion of death certificate, may lead to biased estimation of several epidemiological parameters, as we have seen in the previous session that madam. So based on our certificate only they are going to assign the codes. Then from the proper codes the data will be generated. Then the mortality statistics we are going to get. If there are any inaccuracies, that may lead to biased estimation of these mortality statistics. And one more thing I want to highlight, that every physician has to fill at least one MCCD in his or her career. So when we are treating with the patients, definitely one or the other occasions we will come across with the deaths. So we should try to make such a way that the specific, accurate and complete death certificate we should try to fill it. So mistakes in filling up of the death certificates are not uncommon, and these inaccuracies range from complete certificates, illegible handwriting, to wrong cause or the manner of death. So what are the common errors that encounter in filling up of these MCCD are the mode of dying as an immediate cause of death. They mention only the mode of death, but there is no underlying cause or antecedent cause. So try to avoid it. Then abbreviations or short forms. Abbreviations, for example, some of the physicians, they write it as death is due to MS, that is, or myocardial incompetencies, or sometimes they may write it death is due to MS. So in such cases it can be mitral stenosis, or it can be multiple sclerosis. In such situations, we try to avoid the abbreviations. But in some cases, as Mohan Pawar sir in the previous session told that the COVID-19, even though it is an abbreviation, such standard abbreviations are allowed. But try to avoid the abbreviations, and we should use the full term, full forms of diseases. And in some cases, some physicians only mention the symptomatic remarks. Symptomatic remarks are very much cause problem to the statistician to assign the codes, because somewhere right death is due to jaundice. So jaundice or icterus, there are so many causes. So just writing the symptoms will not help. Then inadequate descriptions. Now coming to the types of errors. The types of errors, it can be classified into major errors and the minor errors. What are these major errors? And these major errors are the errors in the MCCD which causes difficulty for the statistician in the birth and death registrar, where they cannot assign the code. Because of that, then it will lead to the faulty MCCD. So the major errors are mechanism of death listed without underlying cause. That means they have tried to assign the mechanism of death, but they are not mentioned the underlying cause. So here the underlying cause is the most important for the statistician to assign the code. If the underlying cause is missing, then the very purpose of MCCD is not served. So as a physician, we should mention the same format, that is the mechanism starting from the immediate cause, then in a single cause in a single line, then underlying cause and the other significant condition that contributing to death, but that is not relevant to the cause of death. Then the second major error is improper sequencing. They have mentioned the causes, but they are not connected. So in such cases, the time interval will help us. So the thing which is nearer to the death, that would come in the first line. Then that cause may be due to or as a consequence, that should come in the next line. So if we arrange it in a time interval, definitely that sequences can be connected. Then the third major cause is competing causes of death. What are these competing causes of death? Competing causes of death, the physician mentioned 2 or more causes which are not relevant, but they are mentioning in a single line. First thing is they are supposed to mention the causes in a single line, but they are mentioning 2 or more causes in a single line, but they are not relevant. In such cases, again, that will become a error in MCCD. Then the fourth one is unacceptable causes. What has occurred in the terminal event, those causes not at all mentioned. For example, they have mentioned like hyponatremia, so many causes. The main cause of, like if he is a dengue positive, then that is missing, but other irrelevant causes have been mentioned. Those are the major errors. Now coming to minor errors. These are the minor errors where for the statistician that is not a problem, but some of the things are missing. For example, absence of time interval. If we see the most of the MCCDs from the rural areas, there they will not at all mention the time interval between the event and the cause of death. So in such cases, it would be difficult. Then the third one, as I told you, abbreviations. One example, as I told you, that is mitral stenosis or multiple sclerosis. So try to avoid the abbreviations. Then poor handwriting. As we know that the MCI has made the prescription form should be in the capital letters. So it doesn't mean that we should write MCCD in the capital letters. We can write it, but only it should be the legible handwriting should be there, so that it would be easy for the statisticians. These are the main types of errors. Those are the major and the minor errors. Now we'll take some of the examples. If we see the MCCD here, you can see that only the mode of death has been mentioned. There is no underlying cause. The statistician is searching the underlying cause, but that itself is missing. So then this is one of the major error. We should avoid it. So first thing is we are not supposed to mention the mode of death, and we should mention the underlying cause. And again, if we concentrate on this side, the time interval between onset and death is also missing. So this is the mode of death. Next, coming to the next one more MCCD from the another area. Here you can see again the mode of death is only the cardiopulmonary arrest has been mentioned, and there is no time interval. And if we carefully see here, then age is not mentioned in the certificate, and there is no signature. Or obviously in a MCCD there should be name, signature, registration number, details should be there, but the main part is missing. But the lower part of the MCCD, which we are going to give to the relative, their signature is there. So some of the errors we should try to avoid these things. And one more thing, next we will go to the another one where the multiple entries are there. There is right-sided pneumonia, cardiorespiratory failure. Here, if we see they are mentioned two immediate causes. No, we are not supposed to mention two immediate causes. We should mention one immediate, that is one cause in a single line A, then the next cause in the next line, and we should mention the time interval. And here in this certificate also the underlying cause is missing, and other significant condition they have mentioned like severe yamma. What is it can be? It can be mitral regurgitation or mental retardation and gastroenteritis, and time interval is missing. So we should try to avoid the abbreviations, and we should give the time interval. Next, we'll go to the another case. As here you can see they have mentioned multiple causes like aspiration pneumonia, respiratory failure, refractory hyponatremia, hypertension, chronic bronchial asthma, fracture neck of femur on right side. Here they have mentioned multiple causes, and there is no time interval, and there is no connectivity from one cause to the another. So in such we should try to make it connect each other, starting from the immediate cause to the antecedent causes. If we take another example, here the immediate cause is missing, only the antecedent cause they are mentioned, and that too it is mentioned like septic shock and multi-organ dysfunction syndrome. Then here it is very difficult to assign a code, so which is the antecedent cause. So we should try to avoid these cases. Next, one more example, we can see that here one of the doctor has mentioned that the immediate cause is urosepsis, acute kidney injury, and respiratory failure. So again, these things like urosepsis or acute kidney injury, they should come one below the other with a time interval. And the antecedent cause, they are mentioned like Alzheimer's disease. And one more, as I told, cardiorespiratory. Now, if we see the another case here, the doctor has mentioned like sepsis with septic shock. So we should avoid these terms. So you can write like septicemic shock, but we should avoid sepsis with septicemic shock. That is due to acute liver failure. Then it could be, then they are mentioned acute respiratory distress syndrome and then acute kidney injury. But the main cause, which is due to dengue positive, that is missing. So we should try to mention the causes. And one more thing, if you see here, then the time interval is not mentioned. Next, one more case we will take up. This is a case from oncology department where the oncologist has mentioned that death is due to cardiorespiratory arrest in an operated case of CA tongue and floor of mouth with a cachexia. That means they have mentioned the cause of death in a single line. They are not at all bothered whether it comes under immediate cause. They have started with the immediate cause, the continuous in a single sentence. So here they should split it into proper way. The cachexia should come in the first, then next CA tongue, and try to mention the stage also. It will be helpful. And the stage, if the primary and secondaries are no, then it is better to mention the primaries and secondary sites. And if there are any complications associated with the CA. Next, coming to one more case, that is a 59-year-old male was admitted to a hospital with shock and signs of septicemia along with gangrene of left foot. The patient had swelling of left foot and fever since 3 days. He had history of COPD due to chronic bronchitis since 10 years and had diabetes since 5 years. The patient had diagnosed as CA carcinoma pancreas and operated same 5 years back, and the patient died 2 days after admission due to septicemic shock. If we carefully observe the things, the septicemic shock has occurred 2 days and he is a known case of bronchitis since 10 years and he had carcinoma pancreas and operated 5 years back, and because of that he developed diabetes. So if we see the time interval, definitely it will help us. So it is, even though he has diabetes and septicemia, the main cause is carcinoma pancreas. So we can write it such a way that the immediate cause is septicemic shock since 2 days. He had fever and septicemic shock, and that is due to gangrene foot since 5 days, and that may be due to diabetes mellitus, and he was operated carcinoma pancreas 5 years ago. And he had other underlying cause, that is chronic bronchitis, which has aggravated the cause, but it is not directly related to cause of death. So this order, if we follow, then we can avoid the mistakes. So we should try to connect from the immediate cause to the underlying cause with the proper sequence with the time interval, and we should mention the chronic underlying cause. Then we take one more example, a 25-year-old female, 4th gravida, then she had a normal delivery at home. On 5th day of puerperium, she started high-grade fever. Fever was neglected for 3 days. On 8th day of puerperium, the patient was shifted to the hospital. On examination, the patient was febrile, had foul-smelling vaginal discharge. Uterus was not involuted and had tenderness over both fornices. On investigation, the patient was found to be severely anemic. The patient was treated vigorously. On the same day, the patient had oliguria, hypotension, and acute renal failure due to puerperial sepsis. The patient died on the 9th day of puerperium. So here, if we see, the patient is a known case of anemia, but exact duration of anemia, we don't know. She had delivery, then later she developed puerperial sepsis. Subsequently, she developed acute renal failure. So if we connect these events, then we can mention the cause of death as she has acute renal failure since 1 day, then puerperial sepsis for 4 days, and then she had severe anemia, but we don't know the exact duration. That may be the underlying cause. Then one more case of CA that was discussed in the previous session, that is, so whenever there is a CA, the immediate cause is emaciation. that can be due to metastasis of the lymph node, and that may be the primary source, maybe primary bronchogenic carcinoma of the right lung. So here, in such cases, we are supposed to mention the underlying cause as the primary bronchogenic carcinoma of the right lung. Then let us move to the minor errors. What are the minor errors? First one, as I told you, the common minor error in the MCCD here is the time interval. So this is a case of a newborn. Then after 6 hours, the newborn was died. He died because of severe respiratory distress syndrome due to hyaline membrane disease, and he had pulmonary hypoplasia with grade 4. And the underlying cause is the baby was premature and low birth weight and associated congenital deformity of polycystic kidney disease. Here, the only 6 hours is there, and they are not mentioned the 6 hours. So it is mentioned. And one more thing is, we should not fill this form for the stillbirth. It is properly mentioned. If it's a case of stillbirth, we are not supposed to use the MCCD. And the other thing is, as mentioned by Mohan Pawar sir, then we should fill the manner of death and how the injury has occurred. So in this MCCD, the time interval is missing. Next one is abbreviations. Here, if we concentrate, they mention like IC bleed, ESRD, CKD. We should avoid all this, even though some of the things may be known to the physicians, but we should use it. Intracranial bleeding, which site is there, then end stage renal disease and the chronic kidney disease. And here the time interval is also missing. So as I told in the earlier, that we should try to avoid the abbreviations. Then one more, in cases where there may be a broad dead cases. So there the exact cause of death cannot be mentioned and advise medical legal autopsy. We are not supposed to issue this MCCD because after death we are informing the police, then that will be subjected for post-mortem examination, and the final cause of death will be given by the forensic expert or the doctor who is conducting the post-mortem. So there we can get it the MCCD. So when we are not sure, in a case of MLC cases, or when we are not sure of the cause of death, then we are not supposed to issue the certificate of this MCCD. Then one more example, if it's a case of a burns with septicemia with 70% of deep burns, it was admitted. But since it's a MLC case, then body was sent to post-mortem examination. But here, in one MCCD, they have mentioned like body sent for medical legal post-mortem. Then we are not supposed to issue this to the relatives of the patient, so that the MCCD should be collected after the post-mortem examination. Then coming to and also one more common error would be, we are supposed to fill the form 4 for the institutional death. Some in a hurry, the physicians, what they will do, they mistakenly taken the form 4A, which is supposed to be issued for the non-institutional deaths. So we should be very careful while selecting whether it's a form 4 or form 4A. In a hurry, later we cannot say that I was busy, not like that. So when you are selecting the form 4 and 4A properly. Then one more thing is, now in the sex column, there is male and female. Now there may be some cases that can be trans, that is third gender also. If it's a third gender, then we should mention it. Then other minor things are, we should, if we know the manner of death, we can mention. And if it's a case of accident, then there is a column how the injury has occurred. So if it's a case of road traffic accident, whether it is a pedestrian or the car driver when he was crossing the road, then we should mention in the column how the injury has occurred. Those details will help for the statistician, because there are different codes. That is, in a road traffic accident, for a pedestrian, it is a different. For a pillion rider, it is a different. For a four-wheeler driver, it is a different. So if we know from the accurate history, we should try to mention the details of the injury. And one case we discussed with the case of puerperal sepsis, acute kidney injury. Then if the case is related to pregnancy, we should tick here yes. And how it was related, we are supposed to, that is, if the disease was a female with associated pregnancy, we should mention, and was there a delivery. So there is a special mention in the MCCD related to pregnancy, we should assign. And rest of the other things, like we should put the signature and the seal, and here also in the lower column, and date. And as Mohan Pawar sir has highlighted, and do's and don'ts, without seeing a dead body, we are not supposed to give the MCCD unless we have treated that case in the last 14 days. Now, coming to summarize. So, errors in filling of the MCCD will affect the mortality statistics. So, we should try to avoid errors. Then, how to avoid these errors? Every medical institution or the hospital should have a system of review and the feedback. If we have some cases, randomly we take some of the MCCD, what we had, then if we discuss with our peers, so what are the mistakes, then we can rectify our feedback. And one more thing is, the hospital administration should conduct workshops on MCCD. What now the DY Patil Medical College are conducting these webinars or workshops. So regular workshops will help to avoid the errors, and we can get updated. Okay, thank you. These are my references. Thank you very much.
Thank you, sir, for explaining us the common errors in filling the MCCD. Also, you have explained the major, minor errors. Then you have focused on very practical aspects of actual filling and how to avoid these errors. I think this lecture will be very useful to all the delegates, and they will try to avoid the errors and fill it correctly.